Hi, my name is Gabriela Espieso, and I'm going to talk about primary hyperoxaluria. Definition: primary hyperoxaluria is a rare inherited condition resulting in increased excretion of oxalate, with oxalated stones being common. Applications in medicine. Pathology: the buildup of oxalate in the body causes increased renal excretion of oxalate, hyperoxaluria, which in turn results in renal and bladder stones. A stone causes urinary obstruction, often with severe and acute pain, secondary infection of urine, and eventually kidney damage.
Hyperoxaluria, an hereditary disorder that causes a special type of stone to form in the kidney and the urine beginning in childhood, also known as oxalosis. The clinical features of this disease include the following: urinary tract stones in the urine and kidney that are composed of calcium oxalate and lead to kidney failure; cardiovascular, heart block, insufficiency with spasm and even blockage of arteries; skin, livedo reticularis, marble-like mottling and acrocyanosis, blueness of the fingers and toes; skeleton, pathologic fractures, bone breaks with minimal, if any, trauma; eyes, optic neuropathy, optic nerve disease. A key laboratory finding is deficiency of an enzyme called peroxisomalanin glycoxylate aminotransferase, the biochemical basis of this disease. Another key lab finding is continuous high urinary excretion of oxalate. Inheritance of the disease is autosomal recessive with two separate loci. This means that the genes for this disease are on autosomes, non-sex chromosomes, and that parents carry one copy of such a gene, and that the chance for each of their children to receive both of their genes and have the disease is 1 in 425%. By two loci is meant that there are two genes at different spots in the human genome that are capable of causing this disease. Mutations at these two spots perturb the molecular system of protein zip codes and have been found to cause hyperoxaluria. The course of the disease has usually been relentless, leading to death in childhood or early adult life.
Happen in case of primary hyperoxaluria. So normally what happens, the glyoxylate which is formed by different metabolism will be converted to glycine with the help of AGXT, and some amount will be converted to glycolate, and some amount will be converted to oxalate, and these glycolate and oxalate will be excreted in the urine. So most of the amount of the glyoxylate will be converted to the glycine in the peroxisome of the liver with the help of AGXT. So there is a, in case of primary hyperoxaluria, this enzyme is deficient. So this pathway is blocked. So now the glyoxylate will try to take the alternate pathways. So glyoxylate will be more converted to glycolate, which will be appearing in the urine, and more amount will be converted to oxalate. Again, this will enter into the urine. But once the kidney is saturated and it cannot excrete the much amount of oxalate, it starts to accumulate in the plasma. And ultimately, it will start as the calcium oxalate in skeleton of the body.
Classification: there are three main types of primary hyperoxaluria, each associated with a specific metabolic defect. Type 1 is the most common and rapidly progressing form, accounting for about 80% of all cases. Type 2 and 3 account for about approximately 10% each of the population.
Is a inborn error of metabolism, then it is considered as primary. So primary hyperoxaluria is one of the inborn error of glyoxylate metabolism, and it is a recessive autosomal inherited condition. There are mainly of three types. So first one, that is a primary hyperoxaluria 1, which comprises the 80% of total primary hyperoxaluria, and that occurs due to deficiency of alanine glyoxylate aminotransferase. The second type, that is PH2, which comprises 15% of total primary hyperoxaluria, and that is due to deficiency of glyoxylate reductase and hydroxypyruvate reductase deficiency. So this was first was about the deficiency of AGXT, second is about deficiency of GRHPR, and a very rare variant, that is a primary hyperoxaluria type 3, which is consist of around 5% of total primary hyperoxaluria, and which occurs due to the deficiency of this HOGA, that is hydroxyoxyglutarate aminotransferase. So these are different types which leads to primary hyperoxaluria, and that leads to accumulation of oxalate in the system, and that is known as the systemic calcium oxalosis.
Type 1. Signs and symptoms of primary hyperoxaluria type 1 vary in severity and may begin anytime from infancy to early adulthood. Symptoms may include recurrent kidney stones, blood in the urine, and urinary tract infections. Left untreated, primary hyperoxaluria type 1 can result in end-stage renal disease, which is life-threatening. Type 2. Primary hyperoxaluria type 2 is a rare condition characterized by the overproduction of a substance called oxalate, also called oxalic acid, in the kidneys. The excess oxalate combines with calcium to form calcium oxalate, a hard compound that is the main component of kidney stone. Deposit of calcium oxalate can lead to kidney damage, kidney failure, and injury to other organs.
Dr. Mungli here. Today I'm going to explain you on hyperoxaluria. In particularly, I will be explaining you primary hyperoxaluria. Hyperoxaluria basically it means excess levels of oxalates that are found in the urine, and this is generally because of consumption of dietary sources which are rich in oxalates. Generally, the green leafy vegetables are rich in oxalates, and also the green tea. Excess consumption of green tea is known to cause excess oxalate excretion in the urine, giving rise to hyperoxaluria. So in today's video, I am primarily explaining primary hyperoxaluria. Primary hyperoxaluria differ from just hyperoxaluria. So hyperoxaluria is generally because of it is secondary to consumption of excess oxalate containing food source, whereas primary hyperoxaluria is because of inherited condition. It is because of autosomal recessive inheritance of or defect in a gene that is coding for some of the enzymes which are involved in metabolism of glycine. So note that primary hyperoxaluria is because of defect in a metabolic enzyme involved in glycine catabolism. So
Treatment. The goal of treatment for primary hyperoxaluria type 1 is to minimize calcium oxalate deposition and maintain renal function. Early diagnosis and prompt therapy is critical to preserve the function of the kidneys for as long as possible. The current management strategies include high fluid intake, treatment with inhibitors of calcium oxalate crystallization, and temporary intensive dialysis for end-stage renal disease, followed by kidney transplantation. The conclusion. The primary hyperoxaluria is a rare condition characterized by recurrent kidney and bladder stones. The condition often results in end-stage renal disease, which is a life-threatening condition that prevents the kidney from filtering fluids and waste products from the body effectively. Thank you.